Hello, Sophia. So my name is Cheska. I go by she, her, and I'll be your student nurse for today. So before we start off, do you have any preferred names or any pronouns you'd like me to refer to you?
You can just call me Sophia and I go by she, her.
Okay, awesome. So we're going to do an assessment today, but before I explain it any further, I'm just going to turn your lights on, and then I'm just going to put some hand sanitizer. And I'm just scanning your environment if there's any hazards. And I closed your curtain already, which is good for privacy. And so if you don't have any hazards and it's completely safe to do the assessment here, I'll just reposition your bed and make sure you're comfortable. And I'm gonna make you sit. Is that okay?
Yes. Okay.
How was your day today?
Pretty good. How about yours?
Mine was pretty good too. Anything fun going on over the weekend?
No.
I'm just gonna put your seat down.
So,
No fun things doing over the weekend?
no, probably just studying.
Just studying?
Yeah.
So, is this a comfortable position for you, or would you like it
A bit more.
Okay.
Yeah, that should be good.
Just put your legs down a little bit.
Okay.
So, we're going to do a head-to-toe assessment on you today. So, we're going to be inspecting and palpating through areas of your body to check for any abnormalities. So, it's going to be a lengthy process, probably going to take around 30 or like almost an hour to do. So, if you want to take a break, or if you want to use the bathroom, or if you feel uncomfortable, just let me know, okay? Another thing is that since we're palpating through areas of your body, I just wanted to ask if it's okay if I touch you throughout the procedure.
That's okay.
Is it also, since we're going to be palpating, I just want and inspecting and seeing all areas of your body, I just wanted to say that we take confidentiality very seriously and we value it very much, and that the information that I will be taking and assessing for you today will only be shared to your physician and to any other healthcare professionals that will be involved in your care. Okay, so do you feel comfortable? Is your bladder empty? Like, do you
Yes.
need to use the washroom?
Yeah. Sorry, no.
No? Do you feel cold at all, or is the temperature okay for you?
Yeah, the temperature's okay. Yeah.
Okay, so we will be starting with the assessment then.
Okay.
Okay, Sophia, so now we're going to start with your vital signs.
Okay.
So first we're going to do your temperature. This one is a temporal temperature, so it's going to go through your forehead. So is it okay if
Yeah.
I do it? Okay. Okay, so your temperature is 36.9, which is an expected findings because the expected findings for temperature should range between 35.8 to 37.3 degrees Celsius. Okay? So now I'll just do your radial pulse. So is it okay if I touch you? Yeah. So I'll just check for your pulse right here.
So your temperature is 36.9 degrees Celsius.
And I'll do that for 1 minute.
35.8 to 37.0. So next what I'm going to do is I'm going to check your radial pulse and your respirations. So if you don't mind, I'll get and this will probably take up to a minute or so. So we're just trying to make sure that
So now I'm done with assessments of the IRA. So you can keep this. Thank you so much.
on my finding, I found that your radial pulse was 90 beats per minute, which is an expected finding because expected findings for radial pulse range between 60 to 100 beats per minute, and yours was 90. And I also assessed for your respiration rate, and I got 12 breaths per minute, which is also an expected range because the expected range for respiratory rate ranges between 10 to 20 breaths per minute.
Okay.
So now I'm gonna do your blood pressure. So I'll just put this cuff around you, but I'll just check for your brachial artery first. Should be here.
40% of your arm. The bladder is most of the way down, but there's no overlapping, so that looks good.
Your brachial artery is approximately around here.
Awesome. So here, you're going to feel a bit of
Can you roll up your sleeves for me, please? Thank you. Make sure it fits snug around your arm.
yes.
2 fingers can fit inside. Perfect. Doesn't feel too tight or anything. This feels okay.
Yeah.
Okay, awesome. Just clip it on right here.
So I stopped doing the pulse on our blood. So now when I check blood pressure, I'm going to work on it very just so I don't miss the systolic. And if you want, you can just fingers relax on your mind.
Oh, it's the other way.
Sorry.
It's okay. Lift it. Lower it down a little bit.
Because the one that I had, like tags.
So your pulse stopped at around 90. So now I'm going to check for your blood pressure. Can you wiggle your fingers for me, please? My diaphragm to where I palpated your brachial artery. So right here. And I'm going to fix this so I can see. To 130. Or 120, yes, 120.
Okay, that was a good launching there. I forgot one thing. I'm going to expect
pressure was about 90/70. So your blood pressure is within expected finding because it is less than 120/80.
Okay.
I will just put these away and I'll be right back.
Okay.
Okay, so now I'm gonna look at your oxygen saturation. So if it's okay, can you put your fingernail right through there? Awesome.
Symmetrical and your septum is in the midline.
Just wait for it to record. Okay, perfect. So your oxygen saturation was 98%, which is within expected findings because the expected range for the oxygen saturation would be 95% or above, so like 95 to 100%.
Awesome.
Okay, Sophia, so before we start your head-to-toe assessment, I'm just going to do a general survey of your physical appearance, your body structure, your mobility, and your behavior, okay? So with your physical appearance, you appear to be your stated age, and you are alert and conscious. For your body structure, you're sitting upright and you're sitting comfortably and relaxed. And for mobility, I noticed that you came in walking with rhythmical movements and without the use of any mobility aids. And for behavior, you're dressed appropriately to the weather and you are also in a relaxed and a calm state. Okay, so now we're going to start your head-to-toe assessment. So to begin with, we're going to start with your face. So I'm inspecting, looking at your skin color, which appears to be light tan, consistent throughout. For lesions, the skin is intact. The lesions, you have a few acne scars on your cheeks. But have you had them for like a while? You've had them for long, or are they new?
I've had them for a while, yeah.
Okay, so if you've had them for a while, then they're within expected findings, no concerns. And you also, so we talked about integrity and lesions. Can you smile for me, please? Raise your eyebrows and blink. Okay, so your facial features, they're symmetrical with the movement. Okay, so now we're gonna move on to your eyes. So with your eyes, I'm inspecting for your eyebrows, your eyelids, and your eyelashes. So from what I can see, it appears that they're symmetrical to each other, and your skin color continues to be light tan. Your eyebrows are evenly distributed, and so are your eyelashes, and they're curved a little bit. So now I'm going to assess your pupils. Oh, and also your eyelids do not have any lesions on them and the skin is intact. Okay, so now I'll be assessing for your pupils. So first I'm going to measure how big your pupils are with my pupil gauge. So your left pupil appears to be 5 millimeters. And your right pupil appears to be 5 millimeters as well. Let's see. Both pupils are round, which are within expected findings, as well as the size. So now I'm gonna flash light into your eye. I'm gonna observe if they constrict. So I'm gonna start with your left eye first, and I'm gonna do this twice. I'm gonna check your left, and then I'm also gonna check your right on the second time, just making sure that both pupils constrict either directly or concentrically. Okay, so I'll go. Okay. Your left pupil directly constricts. And your right pupil consensually constricts. And I'm going to check out the other side now. Ready? Your right pupil constrict directly. And your left pupil constrict consensually. So that means that that's an expected finding, that both eyes are supposed to directly and consensually constrict to each other. So now I'm gonna do accommodation. So what I'm gonna do is, if it's okay, can you look at the one of the leaves over there? And I have a pen here, but I won't tell you to look at. Don't look at it until I tell you so, okay? Okay, look at my pen now. Just gonna move it closer. Okay, perfect. So based on my observation, I noticed that your pupils converge, so they cross as I move my pen closer to you. Another thing is that your pupils also constricted, so both of those are within expected findings. So your eyes and your face so far are both in expected findings. Okay, so now that we've done that, I'm gonna assess your ears now. So if it's okay, can you tuck your hair behind your ears, please, so I can get a better look at them? Okay, so I'm gonna start with your left ear, and I'm observing your skin color, which appears to be light tan and consistent like your face. I do not see any lesions, and your skin is intact, which are expected findings, and I do not see any discharge on your left ear. I'm now gonna move to the other side.
So now I'm going to move on to cardiac.
So again, I'm looking for the skin color, which is light tan and is consistent throughout. No lesions, and the skin continues to be intact. And no discharge, which is an expected finding. So both ears are within expected findings. So now I'm gonna assess your hearing acuity, so your ability to hear. So in order to do that, I'm gonna do a whisper test. So I'll be covering one ear. So I'll be pressing on it with my finger just to kind of like cover it up, and then I'm gonna whisper a combination of like 3 letters or 3 words, and I want you to repeat them after me, okay? So if it's okay, can you sit at the edge of the bed, please? Awesome. So I'm gonna start with you.
So I see that your skin is intact and you
3, 2, 4,
and I'm just gonna
4, 5, 6,
And one more.
7, 8, 9,
Awesome. Let's do this.
abdomen is flat, and there are no lesions or bumps.
4, 3, 2,
Tiny scratch on your nose.
6, 7, 8, 1, 2, 3.
So you did not make any mistakes on both of your ears, so your hearing acuity is within expected findings. See, I'll move to the other side now, or I can stay here, and if it's okay, you can move back and sit comfortably. So now I'm going to be inspecting your nose. So could you look up for me, just like a little bit? Yes. So the skin color of your nose continues to be light tan. Your septum is not deviated, and it's midline of your nose. There's no obstruction in your nares, and your nares are also symmetrical to each other. And your nose does not have any lesions on them, and the skin is intact, all of which are within expected findings. Okay, so now I'm gonna be inspecting your mouth. So for your mouth, I'm looking for the skin, I'm inspecting for the skin color. So your skin color appears to be pinkish with no lesions, no cracking, and your lips are moisturized and no signs of cyanosis or like bluish or purplish hues on your lips. So now I'm gonna, is it okay if you smile for me so I can inspect your teeth and your gums? So your teeth appear to be whitish yellow, which is expected findings. Your gums appear to be pink. Your teeth have no debris. Yes, your teeth have no debris, and your gums are not enlarged, and they're attached to your teeth. So your lips and your teeth and gums so far are within expected findings. So now I'm gonna do your tongue. So is it okay if you stick out your tongue for me, please? Can you say ah, like this? Okay. There. So your tongue is pinkish with a whitish coat and a roughened papillae. It's symmetrical and it protrudes in the midline. Can you move it to the side, please? Yes. So this one doesn't have any white spots and no lesions. And can you move to the other side? This side also does not have any white spots or no lesions, which is expected finding. And can you move your tongue toward the roof of your mouth, please? Okay, so this side of her tongue appears to be smooth, glistening, and she has a blood vessels that are visible. So your lips, your teeth, your gums, and your tongue are all within expected findings. So after we've done your mouth, I'm now going to do your neck. So if it's okay, can you look up again, please? Okay, so for your neck, I'm looking for the symmetry and the pulsation. So your neck is symmetrical to each other on both sides with no visible masses or lumps or any bulging. And based on my observation, your neck also does not have any pulsations, so like a 0 for a grading scale, which are all within expected findings. So now we're gonna do a strength for your neck, for muscle strength and symmetry. So first I'm gonna do a rotation, which is where I apply pressure on the sides of your cheek. So for example, we'll start on your left side. So what I'm going to do is put my face over here, and I'm going to apply resistance, and when I do that, you're going to move your face towards my hand, okay? So, move please. Okay, perfect. And now I'm going to do the other side now, and just move it towards this side, okay? 1, 2, 3. Perfect. So now I'm gonna do your shoulders. So this is like you just shrug your shoulders, and I'm just gonna put resistance on it by kind of like putting pressure down a little bit, and we'll just do the same thing. We're just assessing for the muscle strength. Okay. Shoulder shrug. Perfect. So based on the rotation and the shoulder shrugs, you have full range of motions, and you fully resisted against the pressure I put. So that would be a 5 out of 5 on for a grading scale. Okay. So now I'm gonna move on to your arms and hands. So if it is okay, can you roll up your sleeves for me so I can get a better look at them? Awesome. So I am inspecting again for your skin color, which is again light tan and is consistent throughout both sides of your arms. I'm looking for any lesions. So there's none so far for your right arm, and none as well for your left arm. And now I'm looking for symmetry and muscular development. So both arms appear to be symmetrical with muscular development as well. And it is your muscular development appears to be within like your age and within your genetics. So now I am going to palpate for any pain, for any swelling like edema, and for your temperature. So I'll just start off with your right arm. Just let me know if you feel any pain, okay? Okay. Is it any painful? No? Okay, now I'll do your left arm. And same thing, just let me know if you feel any pain. You feel any pain? Okay. So feeling no pain is within expected findings. During palpation, I did not feel any swelling in both sides of the arms, which are within expected findings. And so now I'm gonna check for your temperature. So So the expected finding for temperature is that I'm supposed to like feel a consistent temperature throughout your whole arms, no like specific spots that have a change in them, like a change in temperature. And so far that is what I'm feeling. So your temperature is within expected findings. So far your neck and arms are within expected findings, and now I'm gonna move on to your nails. So first I'm gonna inspect for clubbing. So it is when the tips of your fingers are enlarged and are kind of curved. So your your right fingers do not show any signs of clubbing, which is an expected finding, and so does your left fingers. Okay, so now I'm gonna assess for capillary refills, which are like just checking for your circulation. So I'm gonna put pressure in each fingernail, and I'm gonna assess if the circulation comes back by seeing if your fingernails returns to pink after putting pressure on them within 2 seconds. Okay, that's good. And this hand, please. So based on palpation, I observed that your fingernails, all of them, circulation were able to come back within 2 seconds, which is the expected finding for capillary refills. So now I'm going to be assessing your thorax. So in order for me to see it better, is it okay if we can take your gown off a little bit? Just put it like around your abdomen.
Okay, so first I'm going to start with your
Just a little bit lower, please. Thank you. So now I'm checking for your breathing and the accessory muscle use and any retractions, okay? I'll just observe for a couple of seconds.
Can I have your hand? Can I touch you?
Perfect. So based on my observations, you're breathing with ease. And can you, yes. And I'll just observe it again, but looking at your back this time. Perfect. You can go back and sitting comfortably. Okay, so based on that, you did not have any visible accessory muscle use, and I did not see any signs of retractions, all of which are within expected findings for your thorax. Okay, so now I'm gonna check your cardiac. So in order to do that, I'm supposed to check for pulsations in your precordium, but since you're wearing a t-shirt, I'm not able to see it properly. So if you're comfortable, is it okay if you drag your shirt a little bit? Okay. And I'll just observe it again for a couple of seconds. Okay, perfect. You can put your shirt back up. So based on my observations, your pulsations, I was not able to see any, which are within expected findings. So there's no visible pulsation, no abnormal pulsation, your heart is not beating against your chest. So all are within expected findings. Okay, so right after we do the cardiac, we're now gonna move down to your abdomen. So for this procedure, I'm gonna have to lay you back down so I can inspect it properly, because I do have to see the contour, which is the shape of your abdomen. So is it okay if I put your bed back down now? And if it's okay, could you also move your gown a little bit lower? Again, just letting you know, you can let me know if you ever want to take a break, okay? Is that okay for you? So is it okay if you pull your gown down a little bit so we can see your abdomen? And is it okay if you lift up your shirt as well? So for abdomen, I am inspecting for the skin color again. which continues to be light tan and consistent throughout the abdomen. I'm checking for the integrity, which is that the skin is intact and no signs of lesions. The symmetry, so I'm gonna use my pen light for this one just to see it, just so I can see it a little bit more. Okay, so your abdomen is symmetrical with no signs of masses or like any bulging that I'm able to visibly see. So now I'm going to check for the contour, which is the shape of your abdomen.
With Weston, one mistake.
Okay, perfect. So your abdomen appears to be flat, which is an expected finding. Same with the skin color, integrity, and the symmetry. So now I'm going to auscultate and palpate your abdomen, but first I'm going to start with auscultation. So I'll just grab my stethoscope.
Your nostrils seem to be even. Your left and your right nostrils are even. I know. And this is just your head up.
So I'm auscultating first instead of palpating because if I palpate first, that's gonna change the bowel sounds and it could lead to abnormalities when I hear it. So I'm just gonna auscultate first, and I am trying to listen for bowel sounds across all 4 quadrants of your stomach. So if I'm not able to hear anything, so if that was the case, or if that's what happens later, I am going to check each quadrant for like 1 minute, and then I'm gonna go back to your right lower quadrant to check again. So it would take a total of 5 minutes to do a full auscultation before I conclude that your bowel sounds are absent. And when I auscultate, I'm also going to start at the right lower quadrant because that's where your ileocecal valve is, and that's where the bowel sounds are most active.
Do the oxygen.
I'm going to start auscultating, which is listening now. I'm going to start at your right lower quadrant.
Okay, perfect. Thank you. So you can toss the back of your throat and then take out a quarter size. So that's a perfect phonics. And I can see that you have both feet.
Both of them are.
So far, I'm able to hear bowel sounds in your right lower quadrant and in your right upper quadrant.
Oh my god. Okay. So can they see you? So the first thing we're going to start with is the inspection of your face. So I'm just going to objectively look at your face.
Hearing so far are gurgling noises and kind of tingling noises, which are within expected findings. And I'm also using the lenses, which are expected findings.
Contact over, I do observe some hyperpigmentation.
So based upon listening, I was able to hear bowel sounds in all 4 quadrants of your abdomen. I was able to hear gurgling noises and some tingling noises, and I was also able to hear some delays through your bowel sounds. So all are within expected findings for the auscultating part. So now I'm going to move on to palpation. So with palpating, I'm going to move with circular movements across all 4 quadrants of your stomach. I'm going to start at your right lower quadrant, but do you feel any tenderness or any pain in a specific area of your abdomen? No. If that were to happen, I'm going to do the area that you feel any tenderness the least, just so that you could to experience like less discomfort already. Okay, so I'm just going to start in your right lower quadrant then. And I'm looking at your face to check for any pain and then making sure to cover all parts of the quadrant.
Your chest curve, your pulse, your respiratory rate, and your So I'm going to start off with your temperature. Is that okay?
Do your perla, which is your eyes round, and your pupil, first of both eyes, to give you some light and accommodation. So the first thing we're going to do, I'm just going to look at your pupils. And your pupils are
So your temperature is 36.
5 millimeters.
And the second counting is 36.
Okay. Did you feel any pain across any of the quadrants? No? Okay, so based on my palpation, I wasn't able to feel any masses or any swelling across your abdomen. So, but if you feel no pain and if there's no masses, then your abdomen is within expected findings for palpation. So now we're gonna move on to your legs and feet. So I'm gonna move the bed back up, comfortable, and you can also put your gown back up because we will be checking in those areas.
So it's there. And also I do not see
Just let me know if a specific angle feels comfortable here. Is that good?
yeah, it's good.
Sure. That's okay, take your time. So if it's okay, could you move the bottom of your gown a little bit higher so I can see your legs and feet properly. Okay, so I'm inspecting for the skin color of your legs, which continues to be light brown and is consistent throughout. There are no lesions and the skin remains intact. And I'm looking for the symmetry. So I'm just gonna go to the center so I can get a full view. So based on my inspection, both sides of your legs are symmetrical and toward the muscular development. They appear to be consistent with your age and genetics. And the hair distribution, they are evenly distributed. And I do not see, there are no visible like blood vessels or like veins there are no visible veins that I can see right now, which are within expected findings as well. So far your legs are within expected findings for inspection. So now I'm gonna do palpation to, again, similar to your arms, I'm palpating for your temperature, any tenderness, and any like swelling, which is edema. I'm gonna start with your right leg first. Is it okay if I touch?
So we're going to go to her mouth. So her mouth. So on her mouth, there's no unusual dryness.
Left legs now.
So I'm going to check your oxygen saturation. I also need to tell you that for my pressure was
Did you experience any pain during palpation? No. Okay, and during my palpation with your legs, I also didn't notice any bulging, any masses, any swelling like edema. So now I'm gonna do your temperature. So I'm gonna use the back of my hands because that's where they're most sensitive to temperature. And I'm just assessing it if the temperature stays consistent throughout your whole leg. Okay. So based on palpation, both legs stay consistent with temperature. So there's no tenderness, no edema, and consistent temperature. Those are all within expected findings for the legs. Okay, so now I'm moving on to feet. So I'm gonna do. So for the feet, I'm gonna do the same thing with the hands. I'm gonna assess for capillary refills. So I'm gonna check for circulation again. I'm just gonna start with your right,
Expecting final.
your right feet.
95 over 200.
Perfect. Now with your left.
I think that your respiration is 13, which is between the
Okay, so your circulation was able to come back within 2 seconds, which is expected findings. And so for now with the legs, we're gonna do the same thing as we did with the neck. We're gonna do muscle strength. So we're gonna do a plantar flexion and a dorsal flexion. So a plantar flexion is pointing your feet towards the ceiling, and dorsal is just doing a ballerina like tippy toes. So I'm gonna put resistance on the bottom of like your sole of the feet when we do the ballet tiptoeing, and we're just gonna test if you're going against resistance or if you're responding to the pressure. Okay, ready? And toe. Okay. And now we're gonna do the dorsiflexion. And 1, 2, 3, go. Okay, perfect. So your feet have full range of motion, and they were able to dorsiflex and plantar flex against resistance. So the muscle strength rating for that would also be a 5 out of 5. So for the final part of our head-to-toe assessment, I'm just going to check for your neural functions. So your sensory functions, your motor functions, and your cerebellar functions. So we're going to start with the sensory functions. So I have a Q-tip with me right here, and as you can see, this side has the cotton in it and this side doesn't have. So this side is supposed to be smooth, and this side is supposed to be dull or sharp. So I'm just gonna swab across your body, so like your legs, your feet, your face, your arms, and your fingers, or your hands, and you just tell me if what you feel is sharp or if it's dull. And when we do this test, you're also gonna close your eyes. So we're gonna start now. So close your eyes and let me know what you feel.
So we're just going to move on to thoracic cavity. Okay, so
The doll.
Yep.
sure, press down a little bit, just
Soft.
okay. So for this, I'm going
sharp.
to
Sharp.
oh my god.
Sharp.
Yep. And one more.
Soft.
Perfect. So you did not make any mistakes on the sensory test, so that is within expected findings. And now we're gonna do motor functions, or test of your motor function. So with that, we're just gonna do rapid alternating of your fingers. Okay. And can you do the other hand, please?
thoracic region. So
Perfect. So both of your fingers were able to rapidly alternate, and that is within the expected findings for testing motor functions. So now we're going to test the cerebellar function, which is the last part of our assessment. So for this one, we're going to need our legs. So So for this one, we're gonna need the heel of your, say your right foot for now, and we're gonna like alternate that and move that down your left leg. Okay? Can you do that for me, please?
So we're going to go.
Perfect. And can you do the other side now? Okay, perfect. So that was within expected findings because your heel was able to go down the leg fully without slipping. So that concludes our assessment. So that was it for our head-to-toe assessment. Thank you, Sophia, for your time and for your cooperation the whole time. Do you have any have any questions for me? Did I miss anything? No? Okay. So I'm just gonna summarize the assessment. So basically your vital signs, they're all within expected range, from your temperature, your heart rate, your respiratory rate, and your oxygen saturation. And with your head to toe assessment, everything was an expected finding as well, and I didn't notice any abnormalities. So I am just going to let your physician know about that, and we will discuss like any. I'm gonna discuss with them like any plans or what they would like to do, and I'll be right back in like about 5 to 10 minutes since there weren't any problems with your assessment.
Okay.
So you can do whatever you want for now. Just make sure you stay here. Okay? I'll be back.
Okay, thank you.